r/AskReddit by Reddit tells. Doctors of Reddit, what are some of your anti-vax parent stories? Not a doctor, but a story I heard stuck with me. The head of pediatrics from a Toronto hospital, I forgot which one, was giving a talk and told a story about how, early in her practice, she had a little boy in for his scheduled vaccines and was answering the nervous mother's questions. The mother planned to go ahead with the vaccines, but had heard lots of anti-vax propaganda, and so she was worried and had lots of questions. While they were talking, but before they administered the vaccines, the poor little kid suffered a grand mal seizure. It was really bad. The kid ended up getting admitted to the hospital and suffered a fairly serious brain injury. It occurred to the pediatrician much later that if that seizure had hit 10 minutes later, or if the appointment had been 10 minutes earlier, nothing would have ever convinced that poor mother that it wasn't the vaccine that caused the seizure. I had something similar happen. I was reluctantly taking my 2-month-old to the doctor to be vaccinated. He started dragging his head back and forth against his car seat. He'd never done anything like that before. If that had happened after the appointment, I'd have been certain B was having some type of neurological reaction to his vaccines. 4th year med student reporting in. Had a rotation with a pediatrician where we ended up in the classic encounter with an anti-vaccination parent. This lady was a conspiracy theory magnet. She casually mentioned everything from 9/11 to chemtrails. Of course she loved the idea of the vaccine conspiracy as well, opting to not protect her 1-year-old to stick it to Big Pharma. I relayed all of this to my attending after my exam. I would see the patient first, gather history and do my exam to present to my attending physician. He got this sort of lazy smirk on his face that screamed, "Watch this." We go back into the exam room and we cover all of the important bits of a well-child encounter. Growth charts, behavioral milestones, nutrition, sleep, and then we get to vaccines. She lists approximately 15 reasons why vaccines are more dangerous than the disease they protect against, lol. In addition to the various evils of the pharmaceutical industry, my attending listens quietly until she's done with her soapbox about one eternity later, and then interjects with, "Have you considered the possibility that anti-vaccine propaganda could be an attempt by the Russians or the Chinese to weaken the health of the United States population?" In a moment of catastrophic cognitive dissonance, I swear I heard a strange popping noise as her brain misfired. It actually broke her. The allure of the increasingly ridiculous conspiracy theory was just too strong. She ended up agreeing to a modified vaccine schedule. I was flabbergasted. My attending just grinned at me in response. To this day I'm not sure the medical ethics of the situation are totally palatable, but goddamn the result was amazing. Edit. Thanks for the internet points. Remember folks, it's all for the kids. Modern problems require modern solutions, I guess. Saving this comment to share with others later on. This warms my heart. Modern medicine in action. You can't fight stupid with logic. You need to hit them with more stupid. Had a kid come in for generic upper respiratory virus. Asked mom if he was vaccinated, as is routine. She said no. When I asked why not, her response was, "Well, my boyfriend was vaccinated and he still got meningitis, so they don't even work." I told her that's the same as saying your friend got bruised by a seatbelt in a car accident, so you don't wear them when you drive. This may be a dumb question, but isn't meningitis caused by several types of pathogens, bacteria, viruses, fungi, etc.? I thought that the vaccine only prevents the most dangerous bacterial form, but other viruses and bacteria are still capable of causing the infection. I work in trauma medicine. I have had to counsel hundreds of patients on seatbelts. I had a 19-year-old patient who wasn't wearing a seatbelt when he was in an accident. He ended up with a splenic laceration, internal cut to his spleen, that he had internal bleeding from. We admitted him to watch to see if he would need surgery or a procedure to stop the bleeding, or if it would stop on its own. I go to see him for the first time and ask him why he wasn't wearing a seatbelt. His father was sitting in the corner and piped in telling me, "Seatbelts kill people." I looked at his dad and told him, "Car accidents kill people. Your son is lucky he isn't dead. You both need to wear seatbelts." Yes, there are stories of people being strangled by seatbelts. Yes, you can have specific injuries from seatbelts. But if you are in an accident that leads to an injury from a seatbelt, you would have been far worse off not having it on. Just be glad we aren't scraping you off the asphalt. Had a 5 or 6 years old patient who had a super hippie mom. No reason for not vaccinating other than she doesn't want to despite counseling many times. Kid also had asthma and would consistently come in for exacerbations despite prescribing appropriate controller meds. The amount of exacerbations just didn't make sense. One day, I sent my student to see him first, while I called the pharmacy to see if his meds were received. The student came back saying I can't get a history from mom. She's literally falling asleep while talking to me. Also, pharmacy said the meds haven't been picked up from the last 3 visits. That was enough for me to call CPS. Mom was on drugs. Living situation deplorable. Last I heard, kid was moved to an aunt who caught him up with age appropriate vaccines. That poor kid. Thank you for helping him out of that situation. I had asthma horribly as a child and can't imagine not getting my meds. When I was a med student, I had a parent who wanted to do a delayed vaccination schedule. Basically it means that you get all the same vaccinations, but you pointlessly and foolishly do it over a longer time period. The mom had read a book promoting this practice that was unfortunately written by an MD. My pediatric attending had zero chill. Is that the book written by Dr. Blank? Yes? Well, then you should know that I was in the same medical school class as Dr. Blank, but I got much better scores than he did. In medical school I saw a kiddo whose parents refused vaccines, and so when they were given a vaccine refusal form to sign, this form essentially said that the parents understood that refusing vaccines was against medical advice, that their kiddo could get sick from all those preventable diseases, and that they wouldn't hold the doctor/practice liable for any complications that the kiddo may get from said preventable diseases. This mom pulled out a Sharpie and blacked out the part about the doctor not being held liable. The parents thought that we'd be cool with them just changing that form just for them, and they wanted the doctor to be held liable for their moronic choice. Of course this didn't work, and they were told to sign the form or they would be discharged from the practice and have to find another. They refused to sign and were told to leave after given a list of other pediatricians in the area. Not a doctor, but a nurse and a vaccine advocate. Once had a public argument with a friend from long ago. He argued that by not vaccinating his kids and risking terrible side effects and possible autism, he was placing no one else at risk, however acknowledged the potential risk to his kids. After attempting to explain the potential risk to others and him failing to understand, I created an analogy which I still use to this day. Imagine if my kids and your kids get into the same car. Both of your kids don't put on seatbelts. Therefore, if there is an accident, there is an increased risk that your kids will die and also harm my children in the process. This seemed to click with him, and he doesn't share his anti-vax propaganda on social media anymore. I was a medical student when this happened. My attending pediatrician gave me a heads up about the parent I was about to see and decided it would be best if he came into the room with me. 4-year-old kid came in with a horrible cough and difficulty breathing. It was almost sure as hell pertussis a whooping cough. The kid was coughing so bad he vomited on the exam table. He went on to ask about vaccinating her kid and of course she replied no, even though her son was damn near coughing up his lung right next to her. I think my attending had seen enough and had enough of her not vaccinating her kid and had the following conversation with the kid's mom. Attending: Mrs. Blank, I have to ask you, do you trust me with as your son's doctor? Mom: of course I do. Drive blank. Attending: well, there's 2 problems here that we need to address. 1. You either think you are more knowledgeable than me when it comes to medicine, and if that's the case I should no longer be your son's doctor, or you don't trust me as a physician, and in that case I shouldn't be your son's doctor. Mom: blank stare on face. Attending: will you please reconsider giving your son a vaccine? Mom: no. My attending obviously treated her kid, but after this whole ordeal resolved he fired her and her son as a patient and referred them to another pediatrician. He had enough of her shit. I respected the hell out of him after he pulled this move. Thanks for watching. Like the video if you enjoyed it. Comment with your own vaccine stories. Share these videos with friends and family. Subscribe to the channel for more videos. Don't forget to hit that bell notification to be alerted about my new videos.